Hey guys, Dr. Ian with Wellington Family Chiropractic, and today I want to talk about a common question that I get a lot in the office, and that is, should I use heat or should I use ice? So this is a pretty simple concept, and I think once it's explained, it makes a lot of sense. And so hopefully this video will just give you a good idea of when to use one or the other, or how you can actually use both. So typically for my patients, if they come in with a fresh injury, so it just happened that day, or the day before, and they're within that first few days, a lot of times ice is going to be your best bet. So what I'll have those people do is use ice, put it on the area of injury for 10 to 15 minutes, and then give it a 30-minute break, and you can cycle on and off a few times throughout the day. Typically with ice, you do want to have a small, thin towel between the ice bag and the skin, just for safety reasons. And what the ice does whenever you have an acute injury is there's going to be inflammation there, and it helps constrict some of those dilated blood vessels. It can help to decrease the muscle spasms in that area, and it can also help to numb some of those irritated nerves. So it's very beneficial in decreasing your pain sometimes on the acute side of things. Now, when it comes to heat, typically I'll have my patients wait until they're out of that normal acute phase. So typically about 3 days before we start applying heat to a fresh injury. But if you're somebody that has like chronic stiffness in an area, or you're always achy or sore, and it's not a fresh injury, a lot of times heat is really good for those areas, because heat's going to do the opposite of ice. Obviously, it's going to help relax the muscles, improve your flexibility, decrease muscle tension, improve your range of motion. So I find heat really helps just calm areas of chronic stiffness down. And then a lot of times patients will say, well, can I use both? And the answer is yes. It's actually pretty effective, and that's where you can use heat more in an acute situation when you alternate it with ice. So the way that goes is, what you would do first is you would add heat to the area for 3 to 5 minutes, and then you would put ice on it for 3 to 5 minutes, and you would cycle those back and forth for about 20 minutes. But what you want to do is you want to start with heat and end with heat. And the reason why you can do this and it's beneficial is because they do opposite things. But when you expand the tissue and bring blood in, and then you constrict it and force that blood flow out, expand it, constrict it, expand it. As you can see with my hands, you're creating a bit of a pump to that area, so it gets some of the fluid out of the area. It can, again, help decrease the symptoms and speed up your healing time. So sometimes one or the other is going to be better, and sometimes what we'll do is, hey, let's go ahead and use both at the same time in those 3 to 5 minute increments, again, until you hit that 20-minute threshold, cycling back and forth, starting with heat, ending with heat. And you can do that a few times a day, and sometimes that'll make you feel better. So hopefully this video clears some of that up. Ice for fresh injuries tends to really help. Heat more for the chronic stiffness or muscle tightness that's not necessarily from an injury, and then you can cycle those depending on what type of fresh injury you have or what's going on with a different with the problem area. So hopefully this clears it up, helps you a lot, and we'll talk to you soon.